an important paper showing a real-world impact of a medical practice instituting low-carb diets came out in BMJ Nutrition Prevention and Health. And it showed that in this practice, they not only helped put type 2 diabetes into remission, but saved over 50,000 pounds or $65,000 in healthcare costs. I'm Dr. Brett Scher, the medical director of DietDoctor.com, and I love studies like this. And Adele Height wrote a very nice post at DietDoctor.com about this paper that was based on Dr. Unwin, Dr. David Unwin, and his practice. And what this was a paper of all the data he collected over 6 years for patients with either type 2 diabetes or prediabetes who chose to go into who chose to start a low carb diet. So first off, this was not a randomized controlled trial, right? It doesn't prove low carb is any better than anything else. But what it does show is the effect of real world experience of people who choose to try a low carb diet and are supported by their physician to do so. Then over the course of 6 years, he had some dramatic numbers. So let me get those to make sure I get them right. 93% of the people with prediabetes had a normal A1C level, A1C being the measurement of blood glucose, an average estimate over 3 months. So basically that their prediabetes went away. 93%. And 46% of those with type 2 diabetes were able to put their diabetes in remission and reduce or eliminate their medications. That's pretty profound. Now, they also lost 18 pounds or 8 kilograms on average. But here's another important point. When they tracked sort of the blood glucose control compared to the weight loss, they didn't track equally. The blood glucose control was greater than the weight loss. So it was, it doesn't prove it, but it suggests that there was something more than just weight loss triggering the blood glucose control. And they also saw benefits in blood pressure and overall lipids. Now, another important finding, though, was those who were over age 65 or who had had their diabetes for more than 6 years, they also saw improvement. So people over age 65 generally aren't included in most of the trials. And in some trials, they'll only include people who've had diabetes sort of recently diagnosed. So in this real world experience, the elderly patients and the patients who have had diabetes for a long period of time both showed improvement. So again, not a randomized controlled trial. It doesn't prove it's better than a low-fat diet. It doesn't prove it's better than the ADA diet or anything like that. But it shows that it works. A low-carb diet can work in this selected population. So the reason why I started this video by saying I love studies like this is because it's important for us to know what happens in the real world. As clinicians, as patients, as individuals, we want to know what to expect in a controlled trial where the setting is maybe different than what it is in the real world. And I keep using that term, real world, because that's important. That's where we all live, right? We don't live in a metabolic world. We don't live in a research study. We live in the real world. So we need to know what to expect. Randomized controlled trials definitely have their role, and I appreciate those as well. And these types of trials don't tell us everything, but they do tell us low-carb diets work. They work for elderly, they work for people who have had long-standing type 2 diabetes and prediabetes, and they work better than many interventions that we've seen, certainly nutritional interventions that we've seen. So my hat's off to Dr. David Unwin for collecting all this data, for going through the process to publish it. You know, busy clinicians don't often publish their experience because they're busy clinicians, right? They're not researchers. They don't necessarily have the time or resources to do it. But Dr. Unwin did it, and not only is he improving patient care, he's saving the healthcare system money. And that's something we all need to pay attention to, especially here in the United States, when our healthcare system seems to be on a off-rail train towards bankruptcy. So anything that can save the system money, people are going to pay attention to. And if it also, of course, improves people's health, that's the golden ticket right there. So again, thanks to Dr. Unwin. You can read more about this at DietDoctor.com for Adele Height's piece that she wrote. Thanks a lot, everybody. Take care. Have a great day.